Welcome to the Public Education Health Trust presentation for the Juneau Education Association, school year FY24. Public Education Health Trust was started back in 1996 by Alaskan educators. Our goal is to provide the maximum benefits at the least cost. The governance of this entity, the Board of Directors, are 7 individuals who you, as the members, vote on each year. Also, as a member of PHT, you have the opportunity to nominate yourself and become a trustee. These 7 members provide the benefit designs as well as the premiums that are set each year. The office is administered out of the Anchorage area. There are 3 individuals, Rhonda, Rebecca, and Tia, always there to assist you should you have any questions or concerns. At PHT, our purpose is to provide you, our members, with high quality service and access to reasonable health insurance plans. We offer 8 different medical plans that a group, association, or school district can select from. We also are very protective of our members' health claims data. We do not share individual health claims data back with associations or school districts. Your claims are always protected by us. The governance of our board, the Board of Trustees, instills that upon the staff, continually reminding us that our only purpose at PHT is to assist our membership. One of the ways we do that is our administrative cost being so low at less than 5%. We understand that the premium for health insurance that is shared between you, the employee, and your employer has a significant impact on both the school district's budget, but also on your home, your household budgets. If we can reduce the admin cost and leaving more of the dollar to cover the medical, prescription, vision, and dental claims, the better off the individual members are. For the last 5 years, our annual increases have been less than the national inflation rates, and we're doing that to make sure that we don't have significant increases in any one given year. We want that smooth consistency across the board at all times. Begin discussing Juneau Education Association specifically. JEA has negotiated with Juneau School District a flat dollar contribution towards all health insurance benefits. If you are electing to enroll in your health insurance, we do need proof of dependency for you to be able to enroll a spouse, a domestic partner, or a child. If you are married and are enrolling your spouse, please do provide a copy of your marriage certificate. If you're enrolling any children in the plan, please do provide a copy of their birth certificate. If you are adding a domestic partner, on our website there is a financial statement of interdependence that we would want you to complete and have notarized. There are criteria for a domestic partner. Again, those criteria are listed on the form. With the Juneau Education Association agreement with the school district, new hire coverage begins the first day following a 30-day waiting period. So if you are hired and your start date is September 5th, your insurance then would begin on October 6th. Again, just following that 30-day window there. However, for your enrollment purposes, please begin gathering that needed information today as far as your birth certificates and your marriage certificates, so that when you submit your enrollment form, all of that criteria will be there. We are not able to activate any dependent policies until we have that information, and you only have 31 days in which to gather that and supply it back to us. On this screen, you will see the 4 different benefit design plans that JEA has chosen to offer their members. Across the top, you'll see the words Plan CB+, Plan FB, High Deductible B, and Legacy. The first 3, when we look at CB+, that refers to Medical Plan C, Dental Plan B, plus means it has an orthodontia benefit. Plan FB is Medical Plan F, Dental Plan B. There's the High Deductible for the Medical Plan and Dental Plan B, and Legacy. Legacy is a unique plan design that PHT only offers to Juneau Education Association members. As we look at the second line on this slide, we see deductible. Deductible is your annual January through December 100% employee member responsibility. On Plan C, the first $500 of non-preventative care services in a calendar year are 100% the member's responsibility. The /1500 there on Plan CB means that each person in the family has a $500 deductible, but no more than $1,500 for an entire family. When we look at Plan FB, we see that deductible is $1,500 for an individual. Again, non-preventative care services on a calendar year basis on Plan FB would be a $1,500 deductible, 100% the member employee's responsibility. So as you can imagine, when we start talking about the premium or the cost of these plans, we would find that Plan CB Plus is more expensive than Plan FB simply because Plan CB has the lower deductible. Continuing across the side, we have the high deductible health plan, which also has a $1,500 deductible, but unique to the high deductible health plan per the IRS, that deductible includes both prescriptions and medical. As opposed to Plan FB, that deductible is only for medical. Your prescriptions would start with co-insurance immediately. On the high deductible health plan, prescriptions there is no help, no co-insurance available until that deductible had been met. Additionally, if there is more than one person on the high deductible health plan policy, the individual protection of the deductible is not in place. The IRS says that you have to have an embedded deductible of the family rate or of $3,000. I know that was confusing, so let me try that again. Plan FB has an individual deductible of $1,500, a family deductible of $3,000. On the high deductible health plan, if there's only one person on the policy, yes, the deductible is $1,500, including medical and prescriptions. However, if there are two people on the high or more people on the high deductible health plan policy, then the deductible is $3,000. Even if only one member is seeking medical care, the entire $3,000 deductible would need to be met. And lastly, on the legacy, there is a plan that has a $50 deductible. As you can imagine, legacy would be our most expensive plan designed for the employee, and the high deductible health plan would be the least expensive plan across the board. Once your deductible has been met, you and I begin cost sharing, where I'm paying 80% of an in-network claim and you're paying 20% of an in-network claim. Your 20% continues until you have spent $2,000 in coinsurance. $2,000 per person in your family for a cap of $6,000 for the family. On Plan FB, your 20% continues until you've spent $3,000 or $6,000 for the family. On the high deductible, your 20% coinsurance continues until you've spent $3,500 or $7,000 for the family. The legacy plan actually is a 15% coinsurance, but it caps out at $264.75 per member in the household. All of the benefits are nearly identical across the board. We have one unique exception, which Plan FB has 6 office visit copays with an in-network primary care provider. Your first 6 visits at an in-network primary care provider on Plan FB have a $25 copay. The other plans, your primary care provider's office for non-preventative care, all are subject to deductible and coinsurance. But the treatment for conditions is the same across all plans. We cover oncology the exact same way on all plan designs. Orthopedics, cardiology is exactly the benefit for all the plan designs. Truly, the difference between the plan designs is the cost sharing. What is the deductible? What is the coinsurance? That's what drives the difference in the plan designs. In-network preventative care services is 100% free for all members on all 4 plan designs. If you are getting your preventative care wellness exam with an in-network provider and the claim is coded as preventative, it is not subject to deductible, it is not subject to coinsurance. It is exactly the same. We have a unique feature in our system through a vendor called Teladoc. By calling Teladoc, which is a 24 hours a day, 7 days a week access to a licensed medical provider in any state in the United States. If you are on vacation in Arizona, you reach out to Teladoc, they will give you a licensed provider in Arizona. That service is completely free on plan CB, FB, and the Legacy plan. However, on the high deductible health plan, you will be charged $55 unless your deductible has been met. Prescriptions. On all prescriptions, you pay a coinsurance for the medication. On plan CB, it's 30%, FB, it's 30% of the drug's cost. On the high deductible health plan, after your deductible has been met, you will then pay 20% of the drug's cost. The Legacy plan is unique where it has a co-payment based on whether the drug is a generic, formulary, or non-formulary medication. So the prices vary a little bit different on Legacy. You're also given a prescription out-of-pocket max. Members wrote to the trustees and said, I'm a very healthy individual. I will never meet my deductible or my coinsurance. However, I need help on my prescriptions. Why do my payment for my prescriptions just keep on escalating each year? The trustees have implemented a coinsurance maximum. So the maximum that you're going to pay for prescriptions in a calendar year on plan CB is $3,000 per person. On the high deductible health plan, it's $2,050, again, because of IRS rules when it comes to that. These are the differences between the plan designs, the deductible and the coinsurance.